Cancer knows no bounds. It affects people regardless of age, gender, ethnicity, and economic background. But communities in Chicago's south and southwest sides are affected a little differently.
That's the area Sinai Chicago serves. President and CEO Ngazi Ezike and Division Chief of Hematology and Oncology Pam Kozla join us now to share about the disproportionate burden of a breast cancer diagnosis there and how their team can help. Thank you both so much for being here.
Thanks so much for having us.
Yeah, how does care there look different from other areas of the city?
I think the main issue are just the statistics in terms of how cancer affects Black and brown communities versus white communities. And we know very clearly that like you said, it affects everybody, but in terms of who's more likely to die from it, who's more likely to be identified late, who's going to have the more aggressive forms. We know that our women of color are seeing that at a higher rate, and so we really have to step up our education and our messaging around screening and how important that is to get detected early.
So we know that sometimes there are financial barriers that prevent people, or they think that there are financial barriers that prevent them from going to get mammograms. But I just want to question, are there also environmental factors in those areas that also impact whether or not the breast cancer diagnosis is higher?
Yeah, I mean, I think it's well known that some of the common determinants of higher incidence in somewhat lower socioeconomic status women, or specifically African American women, may be related to higher incidence of obesity and some of the other comorbidities which don't allow them to get the right doses of treatment that we're trying to give. And, we have to juggle between not just what's the right treatment versus what's right for this patient. And that personalization of treatment, I think, based on a patient's whole picture, their whole health, is what I think we take pride in. And as a breast cancer team, which is really an all-female team, we have a radiologist who excels in her 3D mammography and tomosynthesis and MRI of the breast techniques. We have a breast surgeon. We have several breast surgeons who are all women. And, it's this comprehensive planning the treatment of a patient, not in a cookie cutter manner, but to say, okay, well, this makes sense from a medical perspective, but how can I deliver this care? Is this meaningful for the patient's quality of life? And giving bare minimum not to affect the quality of life. And I think it's a very exciting time in breast cancer research and treatment, where, we look at the social determinants of health as a part of our treatment planning. And who could do it better than Sinai Chicago? We've got a team, social workers, community health workers, and interpreters all around for the Spanish-speaking patients, which just makes you feel so taken care of.
And seen.
Yeah. Talk about getting the message out in October, and specifically, how do you get to those communities that really need the screening?
Yeah, so we have an Urban Health Institute. It's our research arm of Sinai. They have a program, Health and Healing for Life. And so this employs the amazing community health workers who go in the neighborhood. They're going to different community events, helping people understand about screening and actually helping walk them through the process. We can have all the 3D mammograms and all the ultrasound technology, but if people don't access the care, we're not going to make a dent in some of these numbers we're seeing. And so we actually help people do the screening, schedule the screening, and not just for breast cancer, but for the cervical cancer and for colorectal cancer screening as well. And so help you make the appointment, educate you about why it's so important, figure out the resources you need if it involves getting you to the location site, for, all those wraparound resources. That's what this Health and Healing for Life program does. And I think that's an important adjunct to the care. It's not just about the care, it's about making sure people know to access the care, can help them get the care. So that 360 thing is what we're doing.
Are the mammograms free?
Yes, we have a whole program, especially based on some grants and through the city of Chicago. There is a Illinois breast and cervical cancer program that pretty much allows any woman to get a free mammogram and a free biopsy. It walks them to that stage, and then Sinai, works out some kind of a financial plan if the patient is underinsured.
We've never turned anybody away for lack of ability to pay. We don't do any kind of wallet biopsy. Last year alone, we did $50 million in free care and charity care.
amazing.
So
Wow.
that's definitely our trademark, that we are here to serve everyone. We believe healthcare is a right for everyone.
And are you finding that more women are getting detected earlier than they did 10 years ago?
Definitely. I think the technology, especially in terms of the 3D mammography and tomosynthesis, along with MRIs of the breast for dense breast, and using ultrasound for dense breast, which has become, everybody in the community is much more aware of that now. And that has led to higher detection rates. So the incidence has plateaued for the first time, but we're still at a very high incidence. And the good thing is, as long as breast cancer is localized, 99% cure rate.
Wow.
If it's only in the breast, and if it goes to the lymph nodes, which is called regional, you're still talking 86% in general survival. So I think
Definitely encouraging.
when I talk to patients, it's like that's my opportunity to spread the word into the family, because you get to know your patients so well over the years, and say, hey, go talk to every family member. Make sure your sister, your daughter, everyone's knows. Don't be scared, which was, I think, the number one challenge for women in those communities is the fear of being diagnosed and what it entails.
That is amazing.
Yeah, ladies,
right.
thank you so much
Thank
for being
you
here.
so
We
much.
appreciate it. Grab those phones and scan the QR code on your screen for more information. You could also visit the site at SinaiChicago.org to make an appointment for your mammogram with a Sinai breast health specialist today. Give them a call. The number's right there on your screen.